Hi guys, this is Dr. Luke with Command Family Medicine. This is a unique allergy season. We're dealing with COVID-19 going around, and unfortunately there's some overlap between allergies and viral symptoms. Thankfully there's some easy ways to determine which one you're dealing with. Usually with allergies you're going to have sneezing, watery, itchy eyes, and you may have cough or a little sore throat with it. Just from the drainage, but it's usually going to be a more mild cough with a viral syndrome like COVID-19. You're going to have more body aches, fevers, joint aches. You're just going to feel sick. Usually with allergies, you're not going to feel as sick. But we want to try to help you through this allergy season, just like any allergy season. Lots of people struggle with it. We have lots of pollen and mold in the area, and pollen's starting to tick up. We're not seeing as much mold, but pollen, especially true pollen, is getting higher, and so there's a lot of people struggling out there. And so we wanted to give some of our best tips on treatment and what medications to start with, and if those aren't working, what ones to add. And then it can also be a great way to help determine if you're dealing with a virus or allergies. You can start treating yourself as if it's allergies if you're unsure. First line, what we always recommend is a medication like Claritin or Zyrtec. They're real common. You can get them over the counter. They last roughly all day. You take them once a day. They don't make you tired or sleepy like a Benadryl does. They're fairly cheap. Historically, we actually recommended our patients get them on Amazon because it was a lot cheaper than what we could buy them for. Now, just recently price checked, we can actually get them a little bit cheaper than Amazon, and so we have a fair amount of Claritin and Zyrtec in stock. If you're needing some, and I know a lot of stuff's hard to get on Amazon nowadays, we can ship that to you. Just let us know. Try that for about a week if you haven't been on allergy medication before, and hopefully that does a trick and you can just stick with one medication. If that isn't working, you're still struggling, you're still having itchy eyes, still sneezing despite taking that Claritin or Zyrtec every day, the next medication we recommend that you go to is something like Flonase, which is a nasal spray, a steroid nasal spray that you do once a day. It's something that we have here. You would do it in combination with the Claritin. They work differently, so you can do them together. And typically that combo works really well. We carry that in stock also, and it's about $5.50 a bottle here. Occasionally, if you keep your eye out, like at Sam's Club, and you're somebody who needs to use Flonase a lot, they can actually get it a little bit cheaper than we can. I've seen it down to $3.50 a bottle if you're buying a 6-pack. You can use Flonase for kids as well, starting at age 4. For age 4 to 11, you probably only want to do 1 spray in each nostril once a day, whereas adults, you can do 2 sprays in each nostril once a day. And they also have a Flonase that's made for even younger kids starting at age 2. It's called Flonase Sensi Mist. It's not one that we can get wholesale, $2 last time I checked at Walmart. And so usually that combination is pretty solid and will take care of probably the majority of people's allergy symptoms that they struggle with. If it doesn't, though, you continue taking both of those. The next one we recommend that you add is one called Singulair, or Montelukast is the generic name that we have. It's a once-a-day pill, similar to the Claritin or Zyrtec. It works differently, so you can take them all together. It doesn't make you sleepy or tired, and we can get that one pretty affordably. It's about $1.56 for a month's supply from us. They have a pediatric form as well that's chewable, and we have that also. It's about it's about $3 a month for the pediatric version. And also, kind of in that third line step, if you don't want to add another pill, some people double up on the nasal sprays, and you can do Flonase plus another nasal spray called Astelin, and it works differently than the Flonase. It's not a steroid. And I believe that's one that you do twice a day. It's a little bit more expensive than Flonase. It's about $8.50 a bottle that we have here. And it also, at this point in this kind of this third line category, also, if you don't want to do the Montelukast or add another nasal spray, then this is where you can add in those that Benadryl or medication we carry in stock that's prescription hydroxyzine. That's an antihistamine, which Claritin is also an antihistamine, but it's a different class that doesn't make you tired, where Benadryl and hydroxyzine do. And so we like the hydroxyzine though, because it seems like people don't get as groggy or hungover as they can from Benadryl, and that one costs about $3 for 30 pills to try hydroxyzine, and that works pretty well. It's a good nighttime one you can take, especially if you have a lot of symptoms at nighttime. It can help you sleep a little bit better, clear your symptoms up. And some people even take it during the day, and you can kind of get used to it, and it doesn't make you as sleepy. So that's another one that you can add, especially if you know you're going to be outside a lot. I've used that one personally if I'm out on a camping trip and I know my allergies are just going to be out of control. I'll take that as well, and that can be a good rescue allergy med that can kick in a little bit more quickly. May make you a little sleepy, but will help knock those symptoms out. The next step that we typically would go to or offer as an option would be the Allergy Shot. A lot of people are familiar with, which is basically a steroid injection into your butt, into your glute muscle. And that one can work well. We've found that maybe it lasts around 1 to 2 months. We don't really know exactly how long it's going to last, but that's what we see with our patients. The only downside to that is there can be some side effects where it can increase weight, it can increase your blood pressure, it can make you feel real flushed and maybe anxious, maybe make it harder for you to sleep. It costs about $9 for the combination of steroids that we use in that injection, but for some people that works really well. Even when they're doing those other medications, if they're still struggling, they have a lot of allergy issues. Some people with allergies, their only symptom is just having itchy eyes. And so if you don't want to take a bunch of meds or do nasal sprays, we do have Allergy Eyedrops, which is the same medication as the Astelin nasal spray, but it's an eye drop form. And we have those drops here. It's about $8.20 a bottle. They usually work a little bit better than the over-the-counter allergy eye drops, and they will burn a little bit when you put them in your eyes. It's a little bit uncomfortable, but those can work well if that's really the only symptom that you're dealing with and you don't want to do the others. But typically, we've seen the Claritin and Flonase; those will help decrease the itchiness of the eyes as well. So, and finally, one other thing that we can do here at Command, if you want to really get to the root of the issue and see what you're allergic to, we can do allergy testing. We draw your blood. We do a panel of respiratory allergens for Missouri, and we can see how allergic you are to different trees and molds and dust mites and dog, cat, all that. And then we use a company called Allergy Choices that formulates what's called sublingual immunotherapy, which works similarly to the allergy injections that an allergist would perform, where they have concoction of all your allergens in the shot, and they slowly work up the concentration of those allergens to desensitize your body to them, so that your body doesn't overreact anymore when it sees them out in the environment. And so this works similarly, but it's sublingual drops, meaning you do drops under your tongue 3 times a day, and they work up their concentration on the allergens and help desensitize your body. And so if you just don't want to take all these medications, or even doing all the meds that we're recommending, you're still struggling, this can be another route to go to try to reduce the amount of meds you need to take, or hopefully get rid of them altogether. And so they their prices are pretty reasonable compared to the allergy shots you'd get at an allergist. It's about around $125, I believe, for a 3-month supply of the drops. And the testing, our price, I believe the respiratory allergy panel is around $150 to do all the Missouri respiratory allergens. Hopefully these treatments help you feel better, help you get out and enjoy outside, or on stay-at-home order and everyone's getting cooped up and not get out and socialize and see friends. And hopefully if we can help control your allergy symptoms, you can at least get outside, enjoy some sunshine, go for a run or a walk or a bike ride, and just make life a little bit more enjoyable until all this coronavirus stuff is over. So please let us know if you have any questions or any other treatments that you've heard about that I didn't mention. So we look forward to helping you and hope you have a great day.